Hi everyone, good morning.
Hello, good morning.
All right. Thank you for being punctual, everyone. I'm Isabel. I'm actually going to change my name here. Where do I do that? Well, maybe not. But my name is Isabel. Let me put it here in the chat. Hargrave. I'll be your trainer for health this training year of 2023. And I would just like to check, who is here because I have 4 names in the roll call. So I want to check everybody's in the right place. So I have Eloisa. Is Eloisa here? Yes. Hello, Eloisa. Good morning. I have Natalia Foratini. We have 2 Natalias here. Natalia Foratini. André Sabag.
Yeah, that's me.
Okay. And Raquel Elena. Okay, so Raquel is not here for now. But we have Leandro, Renata, and Leticia Matos. Are you all from the non-Adventist schools?
I am.
I am.
You-
Actually,
Nodding.
Isabel, I'm
Yeah.
one of the coordinators of Alumni Greeks
Mhm.
here in São Paulo. So that's why I'm attending this session to get to know more about the courses. So I'm not actually enrolled in this training session, okay?
No problem. All right.
It's similar to me, because I'm a coordinator from Escola Portal.
Okay. So I will.
I'm not a coordinator, but I am from alumni as well. But I am enrolled in this course.
Okay. Just took a print screen so that I have everybody's name and we can check that later.
Okay.
All right, so let me start introducing myself and then you guys can introduce yourselves and we can get to know each other before we start. My name is Isabel. I've taught as a high school teacher for Griggs in 2019, 2020, 2021, and 2022. So for 4 years, I taught health, fine arts, US government, US literature, and British literature. The only subjects that I never taught was computers, US history, and public speaking. However, I'm graduated in history. My degree is in history. I have an MA in art history. I studied Renaissance art. Well, I was gonna say it's my passion, but I guess it was my passion some time ago. It's been 10 years I finished the master's. And I've been working with Griggs in I like to say the backstage training teachers since 2019. Currently, I give the trainings for health for both networks, Adventists and non-Adventists. And I give the training for fine arts. And besides that, I work with Griggs in some other instances as well. And other than that, I teach English privately, and I'm a history teacher in the Prefeitura of Campinas. I'm from Campinas and I live in Campinas. And I guess that's it. I do some translation jobs as well. So my world goes around whatever related to English and history. Diane is here. Yes, she's just checking in. So I would like to get to know you guys as well. Who would like to start introducing yourselves? And also if you have any questions for me.
Okay. I'm Renata. I'm from Ibeu, Rio. Yes, I live in Rio. I started GIA training courses in 2020, but and then I didn't have a group. I was waiting for a group. And this year in August, and then another teacher left, and then I was able to have my own group. I started with health and fine arts, and now here I am for this course. I had already taken another course in 2021, the one for UK and American literature. But again, I was still waiting for a group. So only in August now that I had this first group. And besides working for GIA, I work at IBEO and then as a teacher. So I have regular groups, okay, like children, teenagers, and adults. And I have been teaching English for a long time. And my degree is in English, really.
Okay. Thank you very much, Renata. My family is from Rio, so I'm very familiar with the city. I used to go there every year my whole life. Ibeu is at, what is the neighborhood that you work at? Because there are more than one, right?
Yes, I work at IBEO Copacabana.
Nice.
I mean, IBEO Copacabana for GIA because I work at IBEO Icaraí, where I live, really, for the other groups, okay?
Oh, it's a little far, isn't it?
Yeah, yes.
Okay, thank you, Renata. Nice
All
to
right.
meet you.
Nice to
Who
meet
would
you.
like to go next?
I can go.
Oh, sorry, the two Natalias at the same time.
Ah,
Natalia, go ahead.
all right, thank you. Okay, my name is Natalia.
I know you already, right?
Yes, I work for a school named Brenta. It's in Itu, but I live in Salto. But it's around 30 minutes far away, so it's pretty close. I started teaching, I think my first subject was American history. And then the following year, I taught American government. And this past year, I did both of them, American history, American government, and public speaking.
And when did you start?
I think it was, let's see, 3, 4, I think it was 2019.
Together with me.
Yes, but it was, forgot, we went to Engenheiro Coelho, right?
Yeah,
It was
Yeah.
before the pandemic.
before the pandemic, the trainings
It was
were
nice.
face to face.
Yes, it was super good.
A different world.
Mm-hmm.
Thank you, Natalia.
Thank you.
Who'd like to go next?
May I?
Yeah, sure.
I'm Natalia too. I'm from São Paulo, live in São Paulo. I'm coming back to Alumni next year as a health teacher in the Greeks program. And I have a BA in psychology, and I've graduated in English and Portuguese too. So nice to meet you all, and I'm a newbie.
But you said I'm coming back to Alumni. So
Yeah,
you used to work there before.
yes, I've worked at Alumni before. I'm coming back in 2024.
Very nice. Nice to meet you.
I can go next.
All right, André.
Okay. My name is André. I am also from Alumni. This will be my first time teaching a classroom. I have taught before as a substitute teacher and also as a private tutor. But this will be my first time taking charge of a classroom. I'm doing the training for fine arts, for health, and for public speaking. And I have a BA in theater arts with 2 minors in psychology and film studies. I graduated in the US around 2 years ago. I'm probably the youngest one here. I'm 23. So yeah, I think that's it.
Just a baby.
I like to think I'm a grown boy, but yeah.
I'm kidding. Very nice. Where did you study, Andre, in the US?
In my point of view, I probably studied in the worst possible state, which is New Jersey. But yeah, I lived in New York throughout my last year.
I
Still
studied in Delaware, so maybe I beat you.
Yeah, I mean, New Jersey has a lot of memes and people talk a lot about it. So I don't know, maybe I got you beat. It's point of view, right?
Princeton is in New Jersey, right?
Yeah, I think so. But it's pretty far away from where I studied. I studied kind of
Alright.
like North Jersey and
Mhm.
Princeton, I think, is south.
Okay. Thank you, Andre. And who would like to go next?
I can go. Yeah, I think that's only me, right? Okay. I'm Leticia. I teach English now, but I began to teach as a Portuguese teacher, but now I teach English, and I teach in the Adventist school from Campinas. And I'm starting to doing this course. I don't know if I'm going to teach in the high school next year, but my coordinator wants me to do it the course, so here I am. And I think basically that's it. I'm 24, so I almost beat Andre.
All right. Leticia, since you said you're from the Adventist school, I think
Yeah.
your group is the other group.
The other group.
It's also with me,
Okay.
but we have a different schedule because we work with different books only for
Okay.
health, and the group is the one that is marked GIA HSA in the timetable.
Okay.
So we're going to have sessions today from starting at 10:30.
It starts at 10:30.
And then we have 3 sessions.
Oh, okay,
today.
perfect. Perfect. Yeah, I see it right now.
So do you
Okay.
think you can join that group?
Yes, I can.
All right. Thank you very much.
Thank you. Bye-bye.
Bye. See you. Every year we get confusions. It's normal because it's health and health. Leandro, would you like to introduce yourself as well?
Sure. Good morning, everybody. My name is Leandro. As I said, I'm a coordinator of the Griggs program at Alumni in São Paulo. I've been working at Alumni for 11 years now, but I've recently joined the Griggs program. I have a bachelor's degree in languages, English and Portuguese, but my major is in translation.
Very nice. Thank you. And then we have Eloisa.
Me. Hey guys. Well, I'm Eloisa. I'm from Sorocaba. I've been working for Escola Portal for some time. I was a teacher in the beginning of the program, the partnership with Griggs, about 10 years ago. I was an American history teacher, but then I started working as a coordinator for the bilingual program, and I'm still there. Now I'm here to update my some information and things we need to ask the teachers to do and so on. So nice meeting you.
Thank you very much, Eloisa. So everybody has spoken, right? Let me get my slides here so I can share. We can start talking. Do you see my screen? Screen I'm sharing? Yes? All right. So in the next 2 weeks, this week and next week, we're going to have our training sessions starting today. If you want to take a print screen of this, we have everything that we're going to cover. So today we're going to talk about course description, course plan, and field trip, plus the material, the book, and teacher resources. Tomorrow at the same time, 8 a.m., we're going to talk about assessment, exam, essays, and projects. In general, assessments in general, and then in session 3 on Wednesday, we're going to go deeper into projects, and you will have time to start preparing your own projects. The idea of this training is that you have time during the sessions to start preparing your materials, because at the end of it, you have to present your portfolio to Karin, right? And you have to have all of those documents ready. So we're going to set some time in each session for you to start working on them. Then session 4 will be on Friday. We'll talk about the GIA teaching methodology, which is something that you already saw in modules 1 and 2 in the video trainings and everything. The lesson plan, and I'm going to teach you a demo lesson of a health class. Then session 5 next week, we will analyze the lesson plan of my demo lesson, and you will start preparing your lesson plan, your own lesson plan for your own health class. And then finally in session 6, the last one, we will have time for you to finish preparing everything that you have started and presenting your documents to me before you can present it to Karen, so I can make any corrections or give you any tips, any help that you may need. All right, any questions here?
Yes, I do have a question. I'm sorry, but I think I'm in the wrong place. I thought it was supposed to be social studies.
All right. Yes.
Yeah, because I read that you had a kind of spreadsheet, and then it was there written like today at 8. And then I thought it was strange because I could only see 3 meetings. And then I saw that Healthy had lots of meetings, and I said, wow, only 3 meetings. And I had an even schedule.
Maybe you mistook it, 8 a.m. for 8 p.m.
Okay, sorry, now I got it.
Social studies here is 8 p.m.
Okay, I got it.
Then you have 1, 2, 3 this week. Yeah, maybe you only have 3 meetings for socials. I don't know, because this year some things changed. So fine arts, we're only having 3 meetings because you have the online training now. And then social studies, you also have the online training that you did on Neutrar. Yeah. So you're only gonna have 3 meetings. The health, we still have the 6 meetings.
All right, so thank you very much. And sorry for interrupting you. See you around.
Bye.
Bye-bye, dear.
Anyone else thinks they're in the wrong place? No.
I am in the right place, but I just want to add information. I'm not teaching next year. I'm not teaching health, but my coordinator suggests me to take the courses. They think it's important for us to understand about all the subjects, but that's it.
Okay. No problem. Right, so let's go back here. Okay, So our aims for today, as a good Griggs lesson, you'll learn that we have to always bring the aims for the day, the beginning of the lesson, and then at the end of the lesson, we review the aims so everything is clear for the students. And today you are my students. No, you're my colleagues, but I'm training you. So the aims for this session is to understand the aims and academic standards for health, to get to know the course materials, and to understand and know how to create and how to use 3 of the documents for the portfolio: the course description, the course plan, and the field trip form. So just remind me, Andrea and Natalia Foraccini, it's your first time teaching for Griggs, right?
Yes, it is.
Okay, so all of these names, I believe they are a little familiar for you because of modules 1 and 2, but we'll dive deeper
Well,
here.
I also did the online course for both fine arts and public speaking, so I did
Mhm.
get more in depth, just not in terms of health, but in other subjects, right?
Yeah, I forgot about that. You guys know me already from the fine arts.
Yeah, I
class.
actually, yeah, I saw your training videos. When I saw your name pop up in the WhatsApp group, I was like, huh, I know this woman.
Okay, great. So let's go. So the course description is that document that gives you an overview of the course. It's kind of our syllabus for the course. Question for you. Can you predict or summarize what a high school level health course entails? And for this, I would like you to answer using Mentimeter, which I'm gonna share with you the code. Let's see. Present. You see the code on top here? Do you know Mentimeter? You can go to this website, Menti, MENTI.com, and then you put in this code. Mentimeter is a great tool for you to use during your classes because it's a website where you can create slides, where you can have polls and people sharing ideas, writing things, and they will pop up anonymously. So I like to use that with the students a lot. When there's a subject that I feel they will be uncomfortable sharing out loud, I used to use Mentimeter to ask things about mental health for the students, for example, or how they feel about this, how they feel about that. And then you have many options. So I like to use during the training some of the tools that I used in my actual classes. So this is one for you to get to know. So you can put here any ideas that you have, like what do you expect from the health course? What do you think is taught in the health course? What may be the objectives of the health course? What we want from the students? What we want to get with the students? Has everybody sent their answers? Yes. All right. So we have here substance abuse prevention. Sexual education, oral presentations, Good Mind, American Health System. Mind, body, self-reflection, first snip of life. What do you mean by first snip of life?
Just experience what life has. Like I don't know. I think I explained in further detail the other like what I thought of that, like sexual education and diversity. So just knowing all the different groups that people might not encounter within their own bubble, you know? I think that's what I meant by first snip of life. Couldn't really put it in words, I'm sorry.
All right, thank you. Physical health, nutrition, mental health, awareness, self-knowledge, group work, terminology, glossary, research, wellness, physical care, self-awareness, diversity in classroom, psychological care. Very nice, yes. And the health course covers most of these subjects, I guess. And also, you put here self-awareness, self-knowledge. What else? Self-reflection. These things are very important for us. So the health course is not it's not a science course and it's not a biology course. It's a course that hopefully the students will learn things that they will be able to apply to their own lives and to the lives of the people around them. So they will get this knowledge and put it into practical use. So by the end of the course, they will have all this knowledge, all this theoretical knowledge, but also tools and conscience to put them into practice and to improve their mental health or take care of their mental health, improve their nutrition, their physical health, start or continue to do exercise or start to do exercise in a healthier and safer way. We do talk about substance abuse prevention. So you guys are very connected with the idea of the course. Let me share again. I'm not used to using Zoom anymore. I'm used to Google Meet now. So, okay, do you see the slides again? Yeah, great.
Yes.
So let's take a look at the course description, which you can access in the planning toolkit. Have you guys accessed your planning toolkit for health yet?
I'm gonna check since I'm not on the list and I'm not on the WhatsApp group. I'm gonna check if Karen added my name.
Okay. How about Natalia and Andrea? Did you have a chance to get into the planning toolkit?
Yeah, I skimmed over it. I went more in depth in the fine arts and the public speaking, but yeah.
Okay, it's important that you have the access in the first place. But you'll see during the training, I will come here many times so that I make sure that you guys know where to find all of the documents, because as you can see, it's a lot of things. But everything is very, very well organized here. The planning toolkit is a lifesaver. Everything you need is in here. If you don't find anything, you're always free to text us in the WhatsApp group and we'll do our best to help you. But everything is supposed to be here. So as you can see, the course description, for example, is here in the folder. And then you have this document in Word, which is the document that you will make for yourself as well, for the portfolio presentation. So this is a standard version, okay? And the course description, it's important to know that you don't change things here. You don't have to change things here, and actually you shouldn't change things here. So what are you going to change? Only the parts that are highlighted in yellow. You will go into the planning toolkit. You will make a copy of the document. You can come here in File and then make a copy, and you will make a copy for your own Google Drive. Okay? File, make a copy, and you copy this for your own Google Drive. And then you're going to change your name and the class period, which is the period when you will be teaching. I don't know if you have this already. Probably not. Some people might have it. So if you have classes like Mondays and Wednesday, or Tuesdays and Thursdays, if it's from 2 to 5 or 6 to 9, or if it's in the morning, I don't know. So you're only gonna change these two things, okay?
Hi, Isabel. I found the 2023 toolkit. Is it? Let me check.
Yeah, I
But
think
it's from 2022 though. It was for this year. Will it work if I use this one?
yeah, I think it's the same one.
They uploaded on 2022 for the 2023 year. So I don't have the one for next year.
I can send the link. I already have it copied here. I can send it in the chat.
Okay.
All right,
So
thank you.
got it.
Thank you.
There you go. No worries.
So now I'm wondering if I'm in the correct one as well. Let me open it.
Also, in this course description, there's also the highlighted part on the bottom of the document. Should we also change that? The project 1 and project 2?
Yes, yes.
Okay.
I was gonna scroll down on the document. So
Sorry, I'm a bit hasty at times.
No, don't worry, it's okay. Right, so here you have the book that you're going to use. Do you have previous access to this book? Did you receive the access? Not yet. Okay.
So the access is not online. We have to request a printed copy with the link that you gave us. Or I don't know if it was you, but someone gave us from Griggs.
Okay. Because I received like a how do you say that? Temporary access to an online version, which I never had this before, even for the training. So maybe this is new. So, but they do have like an online version, but it's a PDF, but it's also in the planning toolkit. But anyways, we're gonna talk about the book in a minute. Then we have the course overview. What are the main ideas about this course, the course standards, and the course outline. So in the course outline, you have the actual chapters that you will teach, that you have in the book. Chapter 1, a healthy you. Chapter 2, psychological health, stress and your health, addiction and drug abuse, alcohol and tobacco, fitness for life, nutrition for life, managing your weight, combating cardiovascular, cancer, and other major diseases, infection and immunity, and health across the lifespan. So this is the curriculum, and as you can see, we have, we skip some chapters. So from chapter 3, we go to chapter 6, so we don't cover chapters 4 and 5, and then we skip chapters 13, 14, and 15 also. It's normal, that's not a mistake, that's what it is. Then you have the projects. So health is a project-based course. We have 2 projects that you have to do, 1 essay and 1 exam. That's the final exam. The assessment forms are here. So project 1, project 2, essay, exam. And of course, we have 10% for homework, assignments, quizzes, and 10% for classroom engagement. And as Andre had asked, the projects you will also change, or you can also change. These were 2 projects that I did with my students, and they are the model projects that you have for your, because you have a document that is a project form that you have to fill out for the project that you're going to work with your students. So these are the 2 models that you have, but yes, you can come up with whatever idea you have for the project as well. All right. I have one person here with me, so it's probably the same Planning Toolkit. Someone is accessing this. Okay, so now I'm gonna ask you to go to that document in your own computer, in your own drive, and you're going to read the session, GIA course standards in the course description, and try to identify the LOTS aims and the HOTS aims. But before you start, let's just remember, what is LOTS and what is HOTS? Do you guys remember that from modules 1 and 2?
Lower order thinking skill and higher order thinking skills.
Yes, thank you very much. And what does that actually mean?
Should I answer that again?
Sure.
It's essentially different skills that are utilized within critical thinking. Some of them require you to go a little bit more in depth, maybe compare, contrast, create. Those are the higher order thinking skills. The other ones are mostly to list, to remember, to understand. And I think that's it.
Okay. So if you can open it in your Planning Toolkit and look at the session course standards and try to identify what would be the LOTS aims for the health course and the HOTS aims for the health course. And you can share your findings in the chat.
I'm sorry, I can't find this. Is it a specific file in the Planning Toolkit?
You couldn't find the course description?
Yeah, course description, yes. It's below the page we were. I have to scroll down. Is it so?
Yeah, it's here.
Oh,
So
okay.
the course description, just scroll down, course standard.
Thank you.
Natalia Merlin, you can use the Planning Toolkit that you have access.
Yes, I'm doing that. Thank you.
Sorry, Isabella, right?
Isabel,
sorry, what would you like us to share in the chat about the standards?
What are the lots and HOTS aims that you find for the health course?
So how exactly should we write it? Should we just copy the entire sentence, or should we just use the keywords?
Yeah, just use keywords. Write it in the chat with your own words.
Okay.
All right. Yeah, maybe I wasn't very clear. The way that Natalia Foracini put, I don't know if you copied it, but it's what it is, like analyze what the influence of family.
Yeah, that's what I got. Whenever they had to use the knowledge they've been acquiring to analyze whatever factors they have here, analyze the positive and negative consequences of health choices. So they had been discussing and had been in content what poor and health choices are. So during classes, we would give them the opportunities to analyze, to identify. Identify would be a lot, lots, and then
Lots.
analyze the hot. So I think there are many throughout all the standards, but I've just chosen some. I'm sorry if I misunderstood.
No, that's correct. That's right. And then you put for lots, demonstrate responsible behavior, understand proper safety and first aid procedures. All right.
Like they
Yes.
have been exposed to that and they would replicate.
Sorry?
They had been exposed to the concepts of responsible behavior, first aid procedures, and then they would just replicate.
Okay. So let's go back to the slides here. I summarized a little bit of the course standards, so we don't have to read through all of that. But I recommend you do take the time later on to read through all the course description as well as the course plan. So the course standards, we have some principles of health, like the terminology, vocabulary usually will be more related to lots, things that they will list, memorize, remember, categorize, classify. Information on health, healthy choices, and the GIA principles of healthy living. Then we have responsible behavior, so safety, health behavior, enhance their own health, reduce risks, and the GIA key values for wellness in terms of spiritual, mental, physical, and social health. Promotion of health. To promote promote wellness in different ways and advocate for the reduction of health risks in the community and global society. And here, of course, we can bring some connection with the community service. If in your school, you will be participating together with the coordination in creating the community service for your students, you can get some ideas from this. The idea of reducing health risks or bringing awareness for the community in global society. Then I got some parts from the course overview that we can read together. Can I have a volunteer to read this page?
Yeah, I can read it.
Okay, thank you, Andrea.
Course overview. The key principles of GIA are dignity, honor, respect, and integrity. The principal values in studying health is to help students learn how to live a long and happy life, incorporating the GIA key values.
Thank you very much. So the GIA key values must be present in every class that you teach. They will be present in every class that you teach, and you will see in the lesson plan how to incorporate them into every lesson. Okay, but it's very important that we work with them. Next one, another person to read, please.
I can.
I-
Oh, sorry. Go on, Eloisa.
Okay, course overview. Students will understand the harmony of nature to recognize the ideal habitat and diet for man. The teachings from a number of inspired sources will be referenced and critically assessed.
Thank you, Elisa. Yes, so today we live in a modern society, and our modern society has many things that distract us or take us off track from what would be the ideal habitat and diet for men. So it's always important that we have this conscience and bring it to the students so that they know how to eat best, how to exercise best, how to live their lives in the best way possible. Next one. So Natalia, would you like to read?
Course overview. The GIA course will cover topics on mental, physical, and emotional health, stress, nutrition, weight, physical fitness, the body systems, diseases, and those behaviors that hurt the body.
Thank you. All right, so after the course description, we have the course plan. And the course plan is where we stop and start planning, the name says, for the semester. The course plan is very important for you not to get lost, okay? When you start teaching a high school subject at Griggs, you will see that it's a lot of content to be covered. It's sometimes it can feel overwhelming if you don't plan accordingly, if you don't plan correctly. So the course plan is here to help you not get lost, because it's not only the content. You have all the content to cover, you have all the material, but you also have the assessments that you need to cover and the field trip. So you have the 2 projects, and they have to have a certain schedule to happen as well. You have the essay. It's only 1 essay, but you know that health is a half a credit course. So it's only 60 hours. And for 1 essay, it's a short time to get the students working, preparing, and everything. And then we have the final exam and the field trip that takes 1 day of class. So if you don't take the course plan seriously and don't follow it, it's possible to get lost, and then it's complicated to, get back on track. So again, we're gonna go to the planning toolkit and check. The course plan is here in the planning toolkit as well. Now, let me know, does the course plan in your planning toolkit look exactly like this one? Yes, great. So again, we have the name of the book. You can change the year for 2024. This is just a model. Then you're going to complete here. When are you teaching? So some schools, they choose, we always teach health and fine arts in the same semester, usually. So some schools choose to teach first health and then fine arts, or the other way around. Other schools teach them simultaneously, like Mondays it's health and Wednesdays it's fine arts. And then we have other schools like Branta, right, Natalia, where you have a different model and you teach the subject throughout the year. So you have to check with your school's calendar, when are you going to teach? But it has to cover 60 hours. So if it's 3 hours per day, it's going to be 20 days. And this model follows that, 20 days of 3 hours each. If you have a different model, you're going to have to adapt this calendar, okay? So here, again, you're going to change what is in yellow, and here the month and the day. And then you have the observations, which is the content that you're going to teach. Here, you already have everything divided for you. Ideally, you can just follow this model as it is here, okay? First day, welcome activity, a lesson about the GIA key values. Then you're gonna show to the students the course description, like the course overview, the topics, material, calendar, and assessment. And then you're going to get into the content. So, for example, in the first day of content, you're gonna teach chapter 1, sections 1, 2, and 3. In the second day, chapter 3, sections 1 to 7, from 1 to 7. And then in the next day, chapter 2, sections 1, 2, and 3. So you see that it goes chapter 1, chapter 3, and then chapter 2. And then here you have chapter 2 again, sections 4 and to 6. All of this division is also done for you in the extra materials in the planning toolkit, which we're gonna see, we're gonna see that today as well, so I'm gonna open. Wait, you have a folder in the planning toolkit that's called resources for the book. And then here you have HLTH, Teacher's Guidelines. So inside these Teacher's Guidelines, you have exactly this division that I was talking about. So these are guidelines for the teachers. And then you have chapter 1, day 2, sections 1, 2, and 3, topic A Healthy You. This is exactly what is in here. Day 2, chapter 1, sections 1, 2, and 3, A Healthy You. And then you have, it's kind of the chapter.
I'm so sorry. My alarm went off while you were explaining. Where can we find this document?
It's in the planning toolkit in this
Oh.
in this folder called resources for the book.
Thank you so much. Sorry to interrupt.
No problem. And then inside it, you have teacher's guidelines. Okay, so you have the learning outcomes, which you can use to create your lesson aims. When you are presenting the aims for the students, it's basically related to the outcomes. Then you have a chapter outline here. Key terms already done for you here in a Google Docs document, so you can copy and use it like to prepare any kind of material. If you want to work with your key terms, like with slips of paper, or put it in a presentation, or use some website or app to use this. Then you have some discussion questions. In class activities, these are suggestions, of course, homework suggestions, and then some extra sources and exercises, suggested readings. And then you go to chapter 2. Chapter 2, you have day 4, 5 of the lesson plan. And then you have the same structure. So this is a very helpful tool for you to work together with the lesson, with the course plan. Check the course plan. What do I have to teach? Then you can come here, check what is outlined for you, and then you go to the book and you see the actual content, okay? Everything to make your lives easier. So here you have all the chapters outlined. Of course, this is a suggestion, okay? This is based on teachers, someone used this course plan, so invite physician to lecture about the topic. It's a suggestion that you can do. Then you have present project 1. Does it have to be on day 10? No, of course not. It's just a suggestion again of where more or less throughout the semester you would ask for the presentation of project 1. And then you have project 2 and the field trip. You can also change the day of the field trip. That will depend a lot on the school's calendar. Whatever place you decide to go on the field trip, you have to check their calendar. So the field trip can happen in the beginning of the course, in the middle, at the end. There is no rule. And then you have the review for the final exam, and the final exam that should be either in the last day of class or maybe in the day before the last. So you have one day to wrap up grades and evaluations and everything. Yes, André.
So I actually have two questions. The field trip is done throughout the class time. So we should plan a field trip that would be around 3 hours long, from what I'm understanding.
The field trip has a lot of margin to work with. So it depends on where you decide to go. Let me give you an example. I used to work, I'm from Campinas, but I worked in Hortolândia in the UNASP Adventist school. Usually we would go to São Paulo for our field trip. So I couldn't plan for a 3 hours field trip. So I would have to take an entire day or an entire afternoon and work together with the school and the students' schedules and the parents we needed to arrange.
But that
Then-
is within the margin of possibility, right?
Yeah,
To extend the field trip above those 3 hours that were given in class time.
yeah. So
Okay.
that's something that you will arrange with your school.
So my second question is also somewhat related to that. I know that the exam is an hour and a half long. I can see it in the screen right now. And the class is 3 hours, right? So for the rest of the class, should we just let them go? Should we have them there to do activities either before or after? Should we go over the exam after they do it? That's my
You can-
question.
Okay, you can arrange that with your school as well, but usually it never takes only 1 hour and a half because students need to arrive and then you can go over the exam with them, explain everything, and by the time you start, you're already used some time of the class. But you can prepare some other activity to do after the exam, something lighter, I would say.
Yeah, of course. But we can go over the exam then, like have them open up the exam and read it with us, ask any questions that aren't directly going to answer the questions for them, that kind of thing. Or no?
You can show them the exam, like the types of questions. So this is the first part, this is the second part, but not read through everything.
Oh, okay. All right. Thank you.
Just to finish about the field trip, you can also arrange a field trip that is not in a class day. If that is something that needs to happen or that's something that is possible with your school, it's a possibility, okay? We've had field trips. Once we had one on a Sunday. And then I've had I was teaching 2 groups. One was Tuesdays and Thursdays. The other was Mondays and Wednesdays. And they were both seeing health. So we did the field trip on a Wednesday for all the groups together. But that was something that I saw with the coordination, with the students, with the parents, and it was possible.
Sorry to ask one more question. If we do that based on, let's say, a museum that is only open for a specific date or during the weekend or something like that, right? If we have to change the date, would that influence the class time that we have that week? So would the students not go to class that week and rather go to the field trip, or no?
You can do that. The thing is, you have to have the total of 60 hours.
Mhm.
So the field trip time counts. So they would have, they wouldn't need to have 60 hours in the classroom plus the field trip. It's 60 hours in total. That's what they need. They can have more. It's always good, not a problem. So then you can see your calendar about that. Okay. But yeah, you guys are all very welcome to ask questions all the time because this is where it's the space we have to clarify everything. Okay. So yeah, this is the course plan. Any other questions about the course plan? Okay. So now we will take a look at the book and some extra resources. You will dive deeper into this when you start to prepare your lesson for the portfolio. But first, so you didn't receive any access for this, or did you? Let me just check because I got this. No, wait.
We received an email with the access to that website, but once we get to that website, the only thing that it will allow us to do is request for a physical copy. It won't give us at least I wasn't able to find an online PDF version of it in the web.
Like you mean this request
Yes.
print sample?
Yes, and I tried clicking, for example, in the
I guess you have this one, Access Instructors Supplement ebook.
yeah, I guess I didn't see that. I'm so sorry.
Access is denied. Well, I tried accessing it another day and I think it worked. But anyways, let's see, request printed. This is weird. I did access the online version because I remember. I don't know what happened now, but I did. It was working before, but that's not a problem because we have the book in the planning toolkit as well. So again, if you go here, resources for the book, HLTH, then you have student's book, chapters. And there you have chapters, of course. The only thing is that the chapters are not numbered the same way as in the course plan. I don't know why, but just focus on the title of the chapter. If it's confusing with the number, just follow the title of the chapter because that's the subject. So we have chapter 1, A Healthy You, and it's a PDF version. This you have the beginning of the book. Here, then it starts. Healthy You, so you always have like the learning outcomes here, lots of texts. So if you need to study the subject of health because that's not your area of graduation, which I believe is everybody's case here, the book helps a lot, okay? And then you have like some more interactive parts, questions here, more text, vocabulary. All the key vocabulary is usually highlighted, not highlighted, in bold. Then you have images that you can use, more key vocabulary here. And the chapter charts, it's always nice to use charts to analyze with the students. So you have like lots and lots of text. Sometimes you have quizzes like this. It's nice to use with the students to make the class a little more interactive. And then the question you're maybe asking yourselves is, do the students need to read all of this? And then I ask you guys this question. Do the students need to read all of this for every chapter?
I'm assuming no.
Yes, no.
I feel like it's our responsibility to try to summarize and condense it and then pass that information on to the students. And if they want to expand on that, like we saw in modules 1 and 2, then we're responsible to inspire them to go and search on their own, both on that book and online, right?
Yes. So we do have subjects in the Griggs High School where the students will do a lot of reading. And those subjects are British literature, and American literature. They will do a lot of reading there. And in American government and American history, there's a lot of reading involved as well. In health, I would say less so. Does it mean they're not going to read anything? Also, no. So they're not going to read everything because that would be just impossible and so boring for them. And it's not in accordance with Griggs methodology. So what André said is correct. It's our job to get that information and bring it to the students in a variety of ways. Reading is one of them, but it's not the only one. So our lessons, they are supposed to mix up many different techniques that students can use to learn. So reading, having a little bit of, forgot the word. When we're teaching, when we're actually teaching and transmitting content, but also researching online, doing the projects, doing other kinds of activities, doing hands-on activities, which they can do a lot with the exercise part, mental health part. There are many things that they can do. Nutrition, if you happen to have kitchen in your school or something that you can use, you can totally do that. And you can use techniques to help your students read as well. So for example, selecting certain parts from the book that they're going to read, jigsaw reading, where you have different students reading different parts, or different groups of students reading different parts and then putting together a presentation for the other groups. Or they will read parts and put together some material, some production out of it. But please don't give them like 10, 20 pages for them to read in class. Okay, so this is the book, and you have all of the chapters here. We already saw the teacher's guidelines. Then you have some other extra materials. Review cards. Let's see, for chapter 2, it's just 2 pages, like quick summary of the chapter. Chapter summary, key terms, figure. Here are the key terms, and the end of the chapter summary. Can use this to create quizzes or to do some activity, review activity with the students. And then you have the slides for the book. Yes, the slides are done for you. What is my take on these slides? You have here chapter 3, stress in your health. And you have all the slides based on the book. Everything is done. Do you need to use it? No, of course not. You can create your own. But this is here to help your life, to make your life easier. So what I like to do is take a look at the slides and then maybe get some of the content. And I personally prefer to put them into prettier slides, you know, and I think it makes a difference with students' engagement when they're looking at something that looks nice. So you can get some of this content transferred to another slide and then add whatever you want to add, remove whatever you want to remove, put more pictures or and make it your own. This is my suggestion. Can you use this as it is? Of course you can, okay? Make it at what works best for you. 2 websites for pretty slides that I use are, I don't know if you know them, Slides Carnival and slides go. They have many, now you have Canva as well, Canva. So you have many models that you can use. Okay, so we have the slides. Web links per chapter. So here are just some extra resources that you can take a look at. Very nice ones. And wait a second. No, yes. I guess that's everything for the book resources. Then you have the Manual de Acesso for Vital Source. So this is probably what you have to check this document to be able to access the online version of the book. Okay, so you should take a look at this document later on and see if you can access. Go to Cengage and then, I don't know, you're supposed to have access to the online version, which is like, it is a PDF, but you can access it in a tablet or in your computer or in your phone through Vital Source. Vital Source is the app where you're going to access the book, okay? And Cengage is the publisher of the book. If you have trouble with this later on, you can also put some messages in the WhatsApp group and we'll see if we can help you. I mean, we will definitely see how we can help you. Any questions about the book? Material. I like it that you have lots of extra resources and the slides just make your life much, much easier. Okay, so the last part for this morning is about the field trip. We've already talked a little bit about it, but here's a question for you. Suppose you could take your students somewhere to learn about health in a practical way. Where would you take them? What are some ideas that you have? I don't know if you've given it any thought already. Oh, I'm gonna be teaching health and I have to do a field trip. What could I do with my students? Where could you take them? Let me remember. André is in São Paulo. Natália is in Itu, which is close to São Paulo. Natalia Foratini also in São Paulo. So pretty much everybody's in São Paulo. What kind of places can you take the students?
Can I use an example? I took my students to for American history to a Fábrica São Luís in Itu, which is a factory, and maybe thinking of the working conditions of the place or something like that.
Like
In the past.
like a food factory.
Yes.
Oh, okay. In terms of American history, thinking about the working conditions.
Sorry, the factory, it was cotton production, fabric production. So maybe thinking of the work conditions of people who work there and things related to that.
okay, but in relation to health. Because I don't know, it sounds like you're thinking about in the past, so history.
Can't we relate how they were treated or how healthy the environment was for them to work or not?
In the past, sure, but I think the field trip should be something like, because it sounds too far away. They go to a fabric factory today to think about the health of workers in the past. You know, I think it's you could do like maybe work safety nowadays. What are the measures for work safety nowadays?
Okay.
Still, in my mind, a little bit of a stretch.
Okay. All right.
Any other ideas? But if it was a food factory, Natalia, that would be nice. Here in Campinas, we have Triunfo, the factory of Triunfo. So the students could go there, learn about how the crackers are made, and hopefully understand that they're not healthy, although they wouldn't be able to say that, I guess, during the visit. And then like talk to the nutritionist of the place and how the food labels are done and all of that, you know.
Field trip doesn't necessarily have to be outside of the school, right? We can invite a guest speaker, correct?
Yeah, so first option is finding a way to go outside of the school. That would be ideal. If you can't do that for any reasons, or during the pandemic, we had a lot of like workshops online, of course, then you can invite a guest speaker. Or, Andre, if you're gonna invite someone for the field trip, it would be nice to have something hands-on. Like I had SAMU and the firefighters visit our school and they gave a workshop. So that was our field trip. They came to the school, but it was very hands-on, professionals of the area and the students learned.
So with that in mind, I do have something that I can suggest. Because my first idea, I don't think is very practical. I know a lot of people that work we call it CAs. It's pretty much I have a lot of friends that work as social workers essentially for autistic children. But I don't even think that that would be a negative experience for the students. I think it can be a little bit too much for the kids that they treat. So it could potentially become something negative, and that's what I'm afraid of. But with that in mind, I did want to focus a little bit on mental health, especially because the pandemic has just ended, and I feel like it's a very predominant issue. I feel like inviting someone that does mindful exercises and doing a workshop about mindful exercises like yoga or intriguing their hobbies through creative means, such as building a sculpture or journaling or something like that, could be something very positive for the students. That's why I was suggesting a guest speaker or a workshop.
In this case, you could think about trying to find a place where you could take the students for like a yoga studio or something.
Yeah, I thought about that too, but I didn't want to stop right at yoga. I would have to do some research on like some places that could potentially talk about mindful exercises in general, but I didn't really want to stop at yoga because I know that a lot of people, especially male students, are going to have a prejudice against it, you know? So I wanted to explore in several different ways, you know.
Or you could go to a park, I'm thinking Ibirapuera, for example, and then have the specialist meet you there and do the workshop there, something like that.
Yeah, I actually do like that idea quite a bit.
Because then you also have
Meet
the
up
part
with
of
us.
connection with nature, and
Yeah.
you know.
No, yeah, I think that's actually a great idea to do it in a public space and somewhere where they can interact with nature. I think is a it's a good idea.
Now, if you want to do the work with a group of autistic kids, you could think about something for the community service.
Yeah, that actually is true. I could do that. It's just that I feel like bringing an entire class to a place that deals with autism would be kind of counterproductive, especially because they can get overstimulated and act out due to the amount of students being there. But I feel like if it were a community service, it could work phenomenally, bringing students a little bit at a time and giving them that opportunity rather than forcing all of them to come in.
Exactly, like smaller groups, and
Yes.
then they can do something for the place as well. I don't know what kind of places you're thinking, but they can do something not just with the people or for the people, but for the place as well, you know.
Yeah. 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 I
Like
think that's a little bit better, but I could think of a few ideas.
our coordinator here in the past did a community service where the students went to a NGO and they painted the wall, the external walls of the NGO, and made it prettier because it was like falling apart.
Yeah, I don't think this is the case for the places that I have in mind, but maybe they'll allow us to do some artistic projects with the students. I don't think
Mhm.
the that would be out of question by any means, you know.
Mhm. Guys, I'm sorry. I will just, oh, so I have a person at my door, I guess. And I just need to take this very quickly. I'm sorry. So meanwhile, you can get into the planning toolkit field trip, and can you start taking a look at the documents? I'll be right back. Hi, I'm sorry. Is everybody there? It's the person that works here, and she arrived, and I had to open the door. Okay, so where were we? So you were taking a look at the documents. Did you have any other ideas of what you can do with for the future? So far we have bringing them to like a professional kitchen or a food factory, or doing some mindfulness work, maybe going to a park and having a workshop with a professional. What else can you do for health? Oh, and I gave you the example of SAMU and the firefighters. They can come to the school or we can go to their place. I've done both. Yes, Natalia.
Yeah, I was gonna ask that because we have a fire department right next to our school. It's really close. And what do you think it would be more interesting for the students to acknowledge the how can I say, working under pressure or taking making quick decisions or learning about safety?
In terms of firefighters,
Yes.
I would say first aid.
Okay.
They love it. The students love learning first aid techniques, the basics of first aid, and maybe safety and like possible hazards in the environment, things like that.
Okay. Thank you.
What else?
I myself think it's a bit hard to think like abstractly because I don't know the students yet, but it has just come to my mind like I take part in a running group, guided running group at Ibirapuera, so maybe they could join a class, they could understand the benefits of this program in their health and see other people because they are of all ages.
Totally.
So take part in a class because
Yeah.
it's outside and it's something different.
You can go so outside, joining this running group for a day, or if you have other things that they could do, like I don't know, I just thought about slacklining or some physical activity. Of course, we need to be careful with this as we are not health professionals ourselves. So if you do want to do something like that, make sure to have a health professional. Like you said, joining in the group you probably have.
Yeah, it's a school that trains us and gives us classes, stretching classes, and what do you say, that thing that we do like
Forma?
you're enhancing and then massaging. It's all supervised and planned. It's not something, oh, let's go and run. No. I take
Yeah.
part in
This might be better as a community service idea, but I do think it could also serve as a field trip opportunity, which is to well, maybe it might be more towards a community service, but go to a homeless shelter and help out there and try to talk to the people that are both working there and using of the shelter's services, right?
Mhm.
So I feel that that could be also potentially a field trip opportunity, you know?
Yeah, depends on how you frame it,
Yeah,
but I agree with you that it sounds more like a community service
yeah.
thing.
I was just thinking of a few ideas here.
Of course.
those lines. Where are we gonna have instruction on community service according to the subject we teach, or is there a separated program for that? for community service?
No, we don't cover specifically community service here, but you have to, I think you have to present the community service document in the portfolio, right? So we can talk about it as I'm talking about it, or if you have, further questions, but it's not part of the training sessions, if it makes sense. But you can make questions and I will do my
Something that could also be really this would be a field trip opportunity would be to we could even go to the school's cafeteria and have the students try to cook for themselves, have a nutrition expert talking about the different types of food that one could potentially cook or that are healthier for you, what we should be looking for in our meals, and then and then have the students attempt to do a simple dish.
Mhm. So I've done cooking as a project, but I didn't have a nutrition expert or specialist. So I challenged my students with, they had to cook a vegan healthy meal because they think vegan and then they will go with a cake full of sugar. And I said, no, it has to be vegan and it has to be healthy, plant-based and healthy. Just challenge them to look for recipes. And then one year we did it in the school. We used the school's kitchen, and then the other years they did it at home and they filmed and registered everything. For it to be a field trip, it would have to be, like you said, Andre, inviting a professional to bring this other input. Also, I don't know the size of your cafeteria in your school, because it would be more interesting if they could go to like a professional kitchen that's larger and involves many things. You could also look for a professional kitchen, or like here at Unicamp we have bandejão, this kind of refeitório kind of place. That could be a nice field trip. Very well. So we're in
Isabel,
ideas.
I was just thinking something that we started doing this year in my school is that like every 3 months the students take what we call a mock exam. They have the period, it's an annual school, so they have like the period of the regular exams, and then they take what we call the mock exam, like simulado, right? And then every time after the mock exam, this year we started focusing on this year. We brought a psychologist to talk to the students, to talk about stress, because nowadays we see so many young students having mental problems, right? And then we take them a day off to, this year we took them to play beach tennis because I play. So I took the students to, release the stress. This was the name of the project. Would it fit as a field trip?
Yes, I guess so. It's a nice idea. Just like I said, if you're taking them to play beach tennis, make sure to have like an instructor, someone who is trained in one area of health. All right. So the field trip is an opportunity for your students to learn something hands-on or to learn something directly from a professional in the area. And the field trip, it has to make sense with what they're learning in class. It's not just a walk in the park, okay? It has to have learning involved. It has to connect with what they're seeing throughout the course, and they have to experience something. So we need to have all of those things together. In order to accomplish that, we need to have before activities, during activities, and after activities. So think about, what is the field trip? What are the students going to do in the field trip? They're going to walk around some place and learn things, have a guided visit, do some activity, listen to instructions from someone. What is going to produce something? What is going to happen during the field trip? And then with this in mind, you're going to prepare before activities and after activities. Before activities can be you introducing the topic of what they're gonna see during the field trip, reviewing something. For example, if you choose to talk to SAMU or firefighters, in your course, you don't cover first aid. But then in the before activities, you can cover the theoretical part of first aid. And I even have a website to indicate to you. It's called First Aid for Free. I think this is the name. First Aid for Free. They can do it like an online activity, an online course, free, and then they are prepared for the hands-on part. And then after activities, what are they going to produce after this field trip? Usually we try to walk away from the obvious. What's the obvious? A discussion about what happened, or a simple slides presentation about what happened. So I would ask you to try to think outside of those options. What can they produce? So for example, you can connect the field trip with one of the projects that they're doing. If, like Andrea suggested, they go to a professional kitchen and they learn from the nutritionist many things and they experience blah, 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 blah. Maybe they will not have time to cook in the same day, but they can cook something as an after activity. Even if it's at home, then of course they would have to register everything, filming, taking pictures and everything. It can be an after activity, or it can be one of the projects linked with the field trip, okay? If they go to the running group, before activities, they will study anatomy, how to say, the circulatory system, stretching exercises. They will study all the theoretical part, the benefits of running, all of that. Then the field trip and after activities, what could they do? I don't know. I need to think about this. But they could do, I don't know if you guys have any idea, after joining a running group for a day.
They could gather a group, like a group of students that are not from Griggs but are from the school to run or to exercise.
Teach what they learned.
Yes.
They could create a program for like starting from 0 to running your first 5K. And they would have to do some research to see how they could build a program that is safe, not to get injured. So that could be an after activity, okay? But it's very important that you think well about all of these steps. So let's take a look at the field trip form. It's in the planning toolkit. I believe you have already, it's this one, opened it. We have the sample and we have the blank form. I will open the sample because then already know what you have to do. It's pretty straightforward. So I have the title of the trip, the duration, how many hours, the date, who is participating, and then the presentation. In the presentation, so this is a part that teachers usually get mistaked. The presentation is, imagine that it's your class, it's your group of students, but for some reason, you want to pass on your field trip idea to the next teacher in the next semester. The person needs to be able to read this and understand what is this field trip, why is it important, okay? Why is it important? Why are you going this place? What's this place? So this one, for example, nutrition is an important part of the health course to offer students an opportunity to develop practical knowledge about nutrition. We have planned a visit to the kitchen of Unicamp to see how one kitchen operates in order to provide a great number of meals to the university community on a daily basis. Always include the website and the address. Website, address, phone number. If you don't have one of them, at least have the other. If the place doesn't have a website, check if they have Instagram account. For example, I'm thinking the running group that Natalia suggests. Maybe they don't have a website, but they probably have an Instagram account. Maybe. Then it's an open group. You don't have an address. But if you're going to Ibirapuera, you put the address of Ibirapuera. Okay. It's very important that you put this in your document, because otherwise it will not get approved and you will have to do it again and put the website and the address. Then we have the goals. What are the goals of the field trip? In this case, also, well, to provide a practical experience of what students have already learned in terms of balanced meals, to promote awareness of the importance of healthy cooking and eating, to educate students on proper personal, environmental, and food hygiene practices, to raise students' awareness on public policies and governmental laws and guidelines regarding nutrition, to relate the topics above mentioned with the GIA key values. Then the description, this is the schedule. What time you're leaving, meeting at the school, leaving the school, getting to the place, doing what you're gonna do in the place. So if you're gonna have like a workshop or a visit, whatever, try to put as many details as possible, and then the time to return. And these are the activities. So before, during, and after. Before, in this case. Can anyone read for me the before activities?
Sure, I'll do it. Before the visit, the lesson preceding the field trip will be dedicated to teaching about nutrition and healthy eating. Students will visit the university website to find out more about it. Students will be encouraged to create a list of questions to be asked to the nutritionists/chefs of the restaurants they will visit.
Thank you. Yeah, so this is nice as well. If the place has a website, they can visit, or I'm thinking about fine arts here, but fine arts, usually the field trip will involve going to a museum. Let's say that in São Paulo, you go to MASP. You don't need to necessarily visit MASP's website, but you can do a virtual field trip to another museum before you go to the actual museum that you're visiting. So you can think about that. You can have like a virtual field trip related to the actual field trip that you're going to do. And this, create a list of questions to be asked. This is a teacher's tip from teacher to teacher, because sometimes we take our students and then we go, do you guys have any questions? And they will go like, no. They don't feel like asking. They think their questions are stupid. They are not paying attention, so they don't have questions. So if you make them create the list before, when you go, do you guys have any questions? It happened to me. They were like, no. I said, no, you do. You do, because we prepared, and please, let's ask the questions. And then they learned maybe 50% more things than they would have without asking the questions. So try to do this. During the visit, who can read this part, please?
During the visit, in the visit, students will have a guided tour by a nutritionist inside the premises of Unicamp University Restaurant, see how food is stored, sanitized, and prepared, learn how the menus are chosen, and speak directly to the nutritionists and chefs of the restaurant and ask questions.
Thank you very much. So just straightforward, the activities that they're going to do. Sometimes I see teachers thinking that during the visit, we need to have a time for the students to do something, to write something, to draw. You don't need that. The visit is the visit. What are the activities of the visit? Oh, it's the guided tour, listening to the nutritionist, experiencing something there. That's it. If, let's say, you're going to a museum and there is a moment where they will sit down and draw and copy from that's fine. But it's not necessary, okay? Focus on taking the most advantage of the time that they will be outside of the school. And after the visit, Natalia Foratini, can you read, please?
In lessons following the visit, students will develop Project 1, which involves preparing a healthy meal on their own and present it to the whole class. Teacher will encourage students to relate to the topic of the
Field trip.
Field trip with the GIA key values.
Thank you. This is also very important. Always connect field trip, projects, essay to the GIA key values, okay? And that's it. It's simple. We just need to do some thinking to understand like what is a relevant field trip and how can we make it the most of it. Just a fun fact, this field trip has never been done. I wrote this project, but I never actually did it. I would love to do it, actually. I did different things back in my day. So just to finish here are some ideas. I know we have only 2 minutes. You guys can take a print screen of this slide. This is some suggestions. Firefighter department, hospital, or SAMU. Of course, if it's a hospital, you need to be careful, like what kind of visit could the students do without getting harmed themselves. Spa Fitness Center, climbing wall. Nowadays, you have a lot of these climbing wall, trampoline places. Professional kitchen, science, or sports museum. You have Museu de Futebol in São Paulo. A professional laboratory also. And then you have some ideas of virtual field trips and workshops. But these are last case scenario. The ideal thing is that we go out of the school with the students, and it's very, very possible. So just to show you guys some pictures of my students, this group, we went to SAMU in Hortolândia. We went there and they gave them, we had a training before with the online website that I showed you, and then they practiced on the dolls, on each other, saw the ambulance. And then with the other group, SAMU came to the school, and then they gave the workshop inside the classroom and the ambulance. And I didn't invite the firefighters. I was just so lucky that the firefighters were at the school in the same day that we're having the field trip, and they're always in contact. So the guys from SAMU called them and said, can you bring the truck around and then like show the students everything? And then they displayed all the equipment all over the floor, and it was very nice. One of my students dressed up as a firefighter and they loved it very much. Okay, so our aims for today were to understand the aims and academic standards for health, to get to know the course materials, and to understand and know how to create and how to use 3 documents for the portfolio: the course description, the course plan, and the field trip. Do you feel like we achieved those goals? Okay. I'm sorry to end this in a rush. I would like to have given you some time to start preparing the documents, but we have 5 sessions ahead of us and we'll have time to work on them. But feel free to start doing, especially the course description, that is just a few things to change, the course plan, see if you have your school's calendar already, and start thinking about the field trip ideas, do some research, look at some websites, okay? Do you have any questions? All right, so I'll see you guys tomorrow at 8 a.m.
See you.
Thank you.
Thank you.
Bye-bye, see you tomorrow.
Thank you.
Bye-bye.
Bye-bye. See you.
Yeah.